Hello and welcome to Uniform Health, the fitness channel that takes a holistic approach to diet and exercise. So today we're going to be doing something a little bit different but kind of familiar to some people, is that we're going to be talking about acne. I think it's important for bodybuilders. I think it's important for everybody. Now, the difference about this particular, I don't want to call it a lecture, but this program that I have set up here is that it takes a multifaceted approach. It's not a one thing. It's a one fits all approach, but it's because it's diversity. We're not going to be talking about necessarily sort of the mundane nature, like this is good, this is anti-inflammatory. This is really going to get down to the pathological understanding and the mechanisms by which many of these products work and why acne occurs. This isn't for the light-minded. This is going to be heavy stuff, but hopefully I'll try and keep it interesting. The other thing that we're going to do is we're going to make sure that we stay conscious of the paradoxical nature of this disease. Alright, so let's get into it. So, acne, investigation into a multifactorial paradoxical chronic disease. They are all right, but when, why, and to what degree? And as you know, that we're going to be talking about all the health gurus that have been, the gut, the microflora. We're going to talk about it all, and we're going to actually form it into a treatment protocol, something that I think people are having difficulty with. So the overview, the billion-dollar industry that shouldn't exist. That's another form of what acne treatments is that it really shouldn't exist at all. So the premise that this lecture will accomplish is that, hopefully, is that it's going to be advancing your pathological understanding of acne. You're going to be able to understand what is acne, what are the different severities of acne, what is the cause of acne. We're going to be talking about symptoms a little bit, pain, itch, etc. So everyone says, stop touching your face. Well, when your face is wicked itchy because you have a bunch of histamine release, it's kind of hard to not touch your face. So maybe addressing the treatments is really the best way of diminishing certain habits that are associated with acne. So we're also going to be talking about, the why me. Why is it that you have acne? Why is it that for you it's so severe? Your brother has acne. What the hell is the difference? And then we're also going to be talking about what you should eat, what you should not eat, and then also what can be done to treat it. All right. Sorry about all the going to give this the best shot I can. It's going to be a long lecture, and I just hope you have the endurance, because I think you're really going to come out of it with a very holistic and revitalized approach to how to treat acne. So the Kitivins, I'm saying that wrong, but this is why everyone assumes that acne is a westernized disease. There's this one study that was conducted on around 12,000 people. That was this group here, this tribe, and they saw absolutely no acne in these individuals. Pretty unprecedented, actually. And one thing to consider is, why do they have absolutely no acne? Some people will say, oh, it's the toxins or something, it's their food. But let's try and break it down a little bit. We're going to be mainly associating with food, but alright, so the diet is completely unprocessed. They're a third world tribe. They don't have any of the modern society sort of indulgences and, unfortunately, toxins. They rarely consume meat. They occasionally consume a pig. That pig has obviously been raised in, they don't use antibiotics or anything over there, so that pig has been raised pretty, I guess, indigenously So, but it's important to note that they rarely consume meat in form of land animals. They do consume fish, and I'm not sure if this is beneficial because of maybe the fish oil component of it, or if there's another bigger consideration that we're going to make, and I'll be talking about that a little bit later, of some of my other theories how fish can be beneficial besides just the anti-inflammatory nature of the fatty acids. One thing that is sort of, again, paradoxical is that it could contain a higher amount of dioxins. This is a chemical that has been associated with acne, chloral acne, and so you could say that, if they consume high fish, they're consuming a lot of dioxins, and therefore they should get acne. However, then you would need to check the concentration of their fish. Maybe the population is far enough away from the typical production practices of westernized culture that they don't have a high enough dioxin content to be poor. For poor health. So now what we're also going to talk about is the sweet potatoes. Sweet potatoes they consume a lot of them. They also known as cassavas, and you could split hairs there, but I'm not going to do that. So sweet potatoes have a high amount of vitamin A, but they have some stimulus on your insulin, but not to the degree that they as regular potatoes do. So this high sweet potato content in their diet may be beneficial because of the vitamin A aspect of the sweet potatoes, among possibly other phenolic compounds. So you could suggest that if you eat a lower meat diet with fish and sweet potatoes, and you keep your carbohydrate, you keep your carbohydrate at 60 and their fat at 30 and your protein at 10, then you would have a chitin-associated diet, and you should, honestly, if you keep it unprocessed, so if you go, I guess, raw, lacto-vegetarian, you could say, then, or not lacto, I forget what fish is, I'm sorry. But if you do this, then suggestively you'll rid yourself of acne because you'll be as close as you possibly can to this, native diet. However, I can't say that's necessarily true. We have to take a much larger approach, considering the fact that if you have 60% of your carbohydrates, you could have those in a variety of different ways, such as maybe dates, which have a very high glycemic index, and that may not necessarily be beneficial for you. So, we're going to go into the deeper depths of acne. So, advancing your pathological understanding. So one thing we have to really understand is that acne is not an antioxidant versus oxidant approach. Therefore, benzoyl peroxide would not be beneficial, which has been very proven to actually have a therapeutic effect. The other thing to consider is that it's not an inflammation versus anti-inflammatory approach. It's not a positive versus negative. It's not a good versus bad. It's a multifactorial. It's not binary. Meaning that there is so much convoluted negative feedback and positive feedback relation, as I'm saying here, is that it's too difficult to say that because one reaction is happening, that's beneficial. So it's not to say that because something is an antioxidant and it gets rid of free radicals, that it is beneficial for acne. For all you know, you could be ridding the body of a free radical which has therapeutic effect against bacteria, and therefore that antioxidant could actually cause you to have acne because you're allowing the bacterium to proliferate. I'm not saying that's necessarily true, but I'm just saying that you have to really develop a complete holistic understanding. Below here I have something I grabbed from Wikipedia, which is the development of breast cancer. These are all the pathways of breast cancer. Clearly, it's very convoluted. You go in one way with a positive entry, and then you come out with some sort of inhibitor that is coming in that inhibits the development of cancer. And so you're saying, well, if estrogen stimulates breast cancer, but then you end up having that estrogen also downregulates certain aspects of growth. Then you just get into which one's stronger on what condition, and then things get very complicated. Sorry, I'm talking a little bit too much here. But I'm just trying to showcase that this convoluted nature is something that we have to really respect with all types of diseases. The other thing you have to really respect is the fact that there is always a subtype. So if you want to talk about tumor necrosis factor, you also have to talk about tumor necrosis factor alpha, beta, gamma, all the different aspects of it. If you want to talk about omega-3s are good, you have to talk about all the different varieties of omega-3, which omega-3 is good. Just like if you're trying to talk about heart disease in saturated fat, you actually have to talk about the certain kinds of saturated fat that have the potential to elevate blood cholesterol. So, with all this data that I'm going to give you and information, you have to respect the fact that you have a lot of investigation still to do within the respective subtypes, because if I say something like histamine stimulates the sebaceous gland and increases sebum production, you have to respect which histamine. Does it matter where it's coming from? And that's something you should really consider whenever you're taking in any of the information that I'm going to give you. Okay, a lot of information, huh? I promised it, so hopefully you're ready for it. So, what is acne? So, it's difficult to say, but let's just get into some of the types here. So we have the normal hair follicle. You see you have the sebaceous gland here. And then you also have an open comedone, also known as a blackhead. And so you have a cloggage here at the upper portion of the indofundum. I'm not saying that right, but I think some people know what I'm talking about. And here you also have a papule, a closed comedone. Some people may call this a amelia. Here's the actual papule where it's getting red and inflamed, and this is a pustule where the sebaceous gland has ruptured and you have a severe lesion. Now, how does this form? Well, if you go back over to here, is that you can see that this is your epidermis, and it's a very complex organ. It's the largest organ in your body, and your skin anyways. The epidermis is the uppermost layer of your skin. But it is the strongest to be associated, because as it's coming here, it dips down. And this dipping in this thin layer of the wall of the follicle, the hair follicle, you see that this is actually what makes up the sebaceous gland, is that it's all in the epidermis. It's not in the hypodermis, because the hypodermis isn't actually forming necessarily anything. It's just fitting in there. It is made up of the keratinocytes of the epidermis, and it's important to recognize that. The other thing it's important to recognize is that these walls shed, and as they shed, that's what's causing the clog. They're releasing proteins and among many other things, and that's what's causing it to clog. So it's not necessarily that you have some sort of dirt on the top here and then it clogs. The clogging is happening in many instances at the very base of the hair follicle, and that's what's so difficult. So here's a comedone, very tiny comedone. Person's lucky to have basically no acne here, but this is a very moderate lesion. Here you have a couple more. This is kind of like a miliae kind of thing going on. It's, as you can see, going back here, this is saying it's mild, this is saying it's moderate, this is saying it's severe. Well, if you have one of these versus maybe 1,000 of open comedones, then maybe the open comedones, having 1,000 of them, is much more severe than the one pustule. And that's what we're going to get into later about grading. So this acne is fairly extensive. There's really no inflammation at the as we can see clinically, but there is certainly an element of acne. So here you have some pustules, so that's a pustule here. Also, many people would call that a whitehead, but also note that they also have several whiteheads here, or blackheads. This is a different form, sort of ice pick kind of acne, kind of going on, or scarring here, along with some sort of cystic acne. So here's the nodule versus cyst. So these are highly inflamed, and I would say if you have severe acne like this, you should really consider the fact that you could have an allergy to a food component, particularly in the case of back acne. That's really strongly associated with dairy consumption, but it'd be beneficial for everyone with acne to not actually taking dairy, and I'll get into that. But okay, so why is this person's nodule or deciding to protrude from the face opposed to be like very deep and more cystic in nature? Well, as you can see here, it's with a nodule, you have vast accumulation of things like neutrophils, and which is pus, basically, a bunch of different immune cells that are really just causing a lot of histamine release in separating the dermis. But with a cyst, you actually have excessive keratinization of the associated follicle, and it's not even coming out because it is actually just really scarring up on the inside of it, and that's what's causing some really intensive growth of your specific area of your face. So you have a lot of immune cells that are releasing a lot of different inflammatory mediators and separating the dermis, and here you actually have a very keratinized area. Keratin is a skin protein that basically is important for adhering to things, and so you have this ball that's forming in your face, basically, as it may feel like. And as this pressure actually accumulates, both here and here, you have increased sensitivity to stimuli, physical stimuli, or chemical stimuli, such as if you poke it, it really freaking hurts. And that's in both cases. So grading. Grading is a fairly difficult thing to do, actually, when it comes to acne. There are over 25 grading scales. What that should tell you is, how the hell do we have any idea, or we can actually reliably stand on any studies that we're looking at, if in fact that there are no complete and agreed upon standards of how to regulate acne? If one scale says papules are more important versus comedones, you could have completely different scales in severity. A pharmacologist could just say, I'm going to use this scale, which basically means that they could use a scale that would enable their product to look better than it actually is, meaning a better improvement of severity of acne based on maybe they got rid of a lot of closed comedones, and so that's one of the way they got rid of a certain severity, or they decided, they got rid of a lot of cysts, so that is how they improved the severity of acne. However, you could still have a lot of papules, and your acne would still be very unsatisfactory, and many people would probably consider it still severe. So even though the scale at which it's considered is less severe, it could still be severe. So that's basically what we're talking about here. It's pleomorphic, meaning that it's a mixture of different types of lesions and uninvolved sites, and very intricate and variable characteristics with each lesion. If you try and say, what causes acne, and you look it up, really you're trying to understand what causes a cyst to form versus a closed comedone versus a papule, which all have different characteristics of pathogenesis because they all have different, physical characteristics. But we're trying to, whenever we type in PubMed or something like that, it's the same. We're looking at the same sort of nature without them really being exclusive to one particular kind of formation, which is really what we should be considering in order to get the best understanding of the development of the disease. So basically what I mean is that because there's so many different kinds of acne, even if in the commonality of acne vulgaris, you really need to, whenever you're researching something, to make sure that what you're looking at is what you're actually looking for. So if you're looking at acne and say, oh, I'm looking at acne, but really you're considering your own face and saying, I have a lot of pustules, I need to look up pustule acne vulgaris or cystic acne vulgaris and how that develops, opposed to just saying acne vulgaris. You have to really have a level of specificity whenever you're researching something, along with a very broad perspective approach. So here is the investigator's global assessment. This is the FDA's form of a grading system. So I'm going to probably just let you read through this. You can just pause it, take a moment. But as you can see, it's pretty good. But, by no means is it perfect. Let's go with 1. So, normal, there's no evidence of acne vulgaris. So here, but okay, I'll go back. So here's the other issue, is that even if you have normal, clear skin with no evidence of acne vulgaris, at what moment? So in this particular moment, you don't have any acne. However, you frequently get breakouts, but this is just one of the times that you don't have acne vulgaris. So, in that instance, could the frequency at which you get an acne lesion also attribute to the severity of it? So, if you have normal for a day, and then you break out for, a week, and then you're normal for a day, but you break out the next day for a week, that's not very normal skin. You're still having a very interesting condition of acne and something that still needs to be addressed, and I don't think that's really the normal that we're looking for. The normal that we're looking for is acne that really very rarely breaks out, whatever that means. Maybe it takes a year for you to break out, or only in certain conditions like bathing in butter or something that you actually break out. That may be a sort of normal that we're looking for. So here we have highly inflamed lesions, predominant variable number of comedones, many papules, pustules, and nodular cysts. Whatever many means. They don't actually quantify the number, so that's really based upon what the dermatologist thinks. And from that standpoint, again, you get in the issue of, okay, so if a pharmaceutical company is paying a dermatologist to say, hey, do you think this is less severe or more severe? And they say, I will give you $100 or whatever it is, or I'm not going to publish the study unless you say it's less severe. Then they'll just say, yeah, sure, there's a little bit less nodules, or there's a little bit less cysts. And so because you don't have a quantifiable number, or at least a ratio or a degree, then you really get into some of the issues with using scientific studies, and what the dermatology is really having a difficult time with acne. You're very unhappy with the approaches that you've probably seen your dermatologist use, or any other holistic people use, and this is in part the reason because we have no idea how to talk about it. I mean, there's even people who use a photo kind of their analytical method. So they'll take a photo of the person before, and they'll take a photo of them after treatment. They'll have an in-person assessment, in-person dermatologist rate the acne, and then they also have two other people who rate it based on their photos of the severity of the acne, and then that can sort of is suggestive that, okay, now we're having I guess which is kind of messed up, a judging of acne. So you have a board that is actually judging how severe the person's acne is, but they're not all going to agree upon the same thing, and so that's what's kind of important, is that we really have a very difficult time, no matter what it is, understanding the severity of acne and the nature of it. So there's a couple other different scales. I'm sorry, this is taking a long time. We have so much to go through. Probably take another 4 hours, but you'll come out of it very well educated. So there's also a couple different scales. There's Lead scale, there's Cook scale, there's Pillsbury scale, there's also the Global Acne Grading System. So these are some of the more predominant scales that are used in research. Another important thing to consider is that the research also has agreed that animal models are a terrible way of finding out whether or not a therapy works. So they're really having a hard time developing a good model besides an area of a personal skin, but no one's trying to actually use an experimental method on their face. Or contrary to that, no one's trying to find out, okay, if you think maybe putting butter on your face is bad, and the dermatologist or the researcher says, I want to try and see if a certain product gives you acne, and I'm going to apply that to your face. Do you accept the repercussions and you'll be benefited financially? They'll say, well, you're going to put something on my face that's going to cause me acne. You better give me a shit ton of money. Matter of fact, I don't even want that because of how difficult it is to actually get rid of. So you have this issue of now only certain people are actually going to be submitted into the group. You have this issue of that the standard therapy, the standard basis of what all of the studies have looked at in order to develop whether or not a therapy works or not, is if it's based on an animal model, now it's basically useless. And the other thing, too, is that we're having a lot of difficulty trying to come up with an actual synthetic model of the epidermis because of all the complicated natures of it. And so we don't have anything except for someone's face. And in that instance, basically, we're having a very limited subgroup of people applying, and we're also having a very convoluted study protocol. So basically, you really have to take all research with a grain of salt, whether that be epidemiological or whether that be clinical. So, although double-blind clinical control studies are certainly something to respect by all means. All right. So the scale of the cause. So a lot of people will say this causes acne, whether it be rubbing skin, picking, or occlusion. Basically, if you put a piece of duct tape on your face, that's occlusion. You're suffocating your skin. Does that make you break out? And what I'm saying is yes here. But you really have to understand the cause of acne. If that causes acne, how does rubbing skin, picking skin, occlusion cause acne? This is what I would call the macro scale. So this is basically the largest scale of a certain an individual cause. Then what you want to get into is the cellular thinking. So maybe rubbing, picking, or occlusion would cause keratinocyte differentiation, inflammation, immune cell mobilization, degranulation of histamines. There are a variety of things that the rubbing would cause, or maybe a chemical that you would put, such as glycolic acid, that would quote unquote cause these things to happen. And so if you're going to try and say that degranulation of mast cells causes acne, what causes that? or what is it that the mast cells are releasing that are causing acne? So now you have this back and forth. Does this cause acne or does this cause acne? Or you get down to the molecular level, which is the level after what the degranulation process is. Basically, when a mast cell bursts, that's degranulation. So if you get into what is it that these mast cells are releasing that make them cause acne, and you could say that it's histamine, you could say that it's substance P, all these other components. And so if you're going to say that insulin causes acne, or if you're going to say that, this is really hard to listen to, I'm sorry, but if you're going to say that DHT causes acne, a form of testosterone, the most active biological form of testosterone, then how do those things cause acne? And then you get back into the genetic basis of it, and then you could say that it downregulates FOX3 or that it upregulates SOX9 and all these bases, but you still need to go from there. You need to go from the genetic standpoint, the transcriptional standpoint, and then say, well, you really have to take it back up to the cellular scale, because that's what you're looking at. That you're looking at cellular components. You're not looking at necessarily DNA per se. You're looking at different proteins. You're looking at different, whenever you look at a lesion, you're looking at histamine mast cells. That's really what you're looking at, and that's what's really forming. So genes aren't forming, they aren't anything structurally. And that's what's important when you're considering a pathological disease, is that there's a structural change from a chemical stimuli. And so if you go back up into here, you want to see how the genes cause a change from this in a structural cellular level, and that's how you can understand a disease. If you go from the macro to the cellular to the molecular to the genetic back into the cellular, if you can do that in a model, then you can understand at least some of the fundamental components of one simple stimuli, meaning one simple quote-unquote cause of the disease. If you can't do that, then clearly you don't understand what's causing the disease, because if you can only go down to the FOX3, then clearly you don't understand how FOX3 causes acne. And if you don't understand that, then you don't understand how any of these things really cause acne, and you don't really understand how to treat that. You can pause at any time, just take a record of how far along you are and then come back to it. I have to do this all at once, because if I don't, people won't actually walk all the way through it, and I'll have to break it up into too many pieces, and you won't actually get a complete comprehensive understanding of the disease and really change the way of how you treat your face. Your face is not an experiment. It's not this playfield. You don't just take any damn product and throw it on your face just because you heard that this is an anti-inflammatory, this is an antioxidant, or this is, has acid that balances my acid mantle. Don't just do that based on one sort of mechanism that you really don't even understand. You really have to get into the basis in the scientific understanding of how that therapy is supposed to work and how effective it is. If you don't have that, then you're really treating your face like some sort of chemical playground, and that's not the way that you should really be appreciating yourself. And don't operate with a scared senses. Don't be so scared of the fact that your acne is going to get worse that you just jump to one therapy to another. Try and do the most fundamentally sound therapies, the ones that make sense to you at the most basic level, and then change your approaches. So more specifically, what I'm talking about there is change your diet, and from there, start developing some sort of topical regime. Okay, so now we're going to get back into that sort of back and forth approach which I talked about before that was really exhaustive. What is the cause of acne? Microchromadone formation. So you can't get acne if you don't have a blockage in the skin, because without that blockage, everything's just going to come out of your pore. So what all dermatologists have really recognized is that it is the microchromadone formation that is very much important from a cellular standpoint, structural standpoint, that causes acne. And people will say, well, it is... So, from that understanding, can blank cause acne? You bet. Like, anything can cause acne. Literally anything can cause acne, because you can be allergic to anything, and your body has a way of doing absolutely anything to cause acne. But you need to understand that certain things are more prevalent at causing acne than others. So going back to the microchromadone formation, what is a microchromadone? But that is the majority, is keratinocytes, all bundled up, because they're not either differentiating well, or they're not proliferating correctly. And it's because of that you get this microchromadone. However, going back into it all, what causes these keratinocytes to not differentiate appropriately, or to cause them to hyperproliferate? Now you're getting back into inflammation and testosterone and other components. So a lot of people are fighting whether or not inflammation is the initiative cause of acne, or if it's this follicular development. Because if you consider this, if you have hyperproliferation and and you don't have proper differentiation, you have retention of these keratinocytes, you have a growing mass in the follicle. And as that follicle sort of pushes on the sebaceous gland, that's going to cause releases of certain inflammatory molecules. And you could say, well, your inflammation is caused by the proliferation of these keratinocytes. But someone will say, no, how can the proliferation even occur without the inflammatory response? It has to be that the inflammatory response is responsive for the proliferation and the keratinization of the microchromadone, because there's nothing else that can actually cause this sort of characteristic of keratinocytes. And so you have this back and forth, the chicken or the egg. Does the keratinocytes build up cause inflammation, or does the inflammation cause keratinocytes? Here's where I think that it doesn't friggin' matter, in all honesty, because first off, it's happening. Second off, I'm sure there's many cases where you probably have the follicular epidermal proliferation of the keratinocytes, anyways, building up inside the sebaceous gland before you have the inflammation. And I'm sure you have actually much more cases of the inflammation before you have the hyperkeratinization of the sebum gland. So I think this is really where you get to a root. So there's two different ways you could get acne. You could get it through this hyperproliferation standpoint first, or you could get this from this inflammatory standpoint first. And the drivers of each of these are really are different, and a lot of times can also connect at the same time. So I don't think this, finding the whether or not it's the chicken or the egg really matters. Is we should really consider that here is where individuals can differ. Some individuals can have a more inflammatory driven acne. Some people can have a more keratinization driven acne. And here's where we can really possibly consider certain therapies in changing how we treat individuals. But again, I really think that because of allergies and because of all the other components, that inflammation, because it's really kind of a bullshit response, meaning basically anything that the immune system is anything that the body is responding to, that inflammation is the cause of the majority of acne, probably 75% at least. But going back here again, excessive sebum production, you could get into again what causes excessive sebum production and bacterial infection. So, stepping back, it has been recognized that at least lipid preoxidation, follicular epidermal proliferation, inflammation, excessive sebum production, and bacterial infections are the primary drivers for acne. And I should say the primary stimuli for acne. And it's too hard to say which one it really is. Some people it may be this lipid preoxidation. If you stand out in the sun all day, maybe. Some people it may be excessive sebum production, which could then end up causing more bacterial more bacterial development, which will end up causing a virulent factor to be expressed. So it will cause the bacteria to say, oh shit, there's a lot of me, time to produce my toxin, and so, which is what staphylococcus do, and P. acne. And so because the sebum production is causing the bacteria to hyperproliferate, now you're going to get in the inflammation, and now you're going to get into all the other things. So all these things drive acne. All these things can cause acne, just like all these things can end up being your cause of acne. And you have to really, because this is the only way to take it, is that you have to take it from a very holistic approach. I apologize, but I have to stop here, and I will be back.